Hello, Dr. Lin here. Today I would like to discuss thyroid antibodies and why people are walking around with Hashimoto's disease and they don't even know it. You know, you may have Hashimoto's disease and not even know that you're having this problem. Why do I say this? Well, if you're going to your doctor complaining of common hypothyroid symptoms such as fatigue, weight gain no matter how hard you try to lose weight, constipation, you feel cold all the time, especially in your hands and feet, heavier than normal blood flow in your menstrual cycle, your skin is really dry, hair is thinning out, your hair might even be falling out, you might even be depressed. Now your thyroid lab tests come back normal and your doctor tells you your thyroid is perfectly fine. And you walk out of the office without relief from any of the common symptoms. Have you had your thyroid antibodies tested? Are you sure? A lot of people say they've had these checked, but the reality is they really have not been checked. Many medical doctors do not check the thyroid antibodies, and if they do, they sometimes just check one and there are two that need to be checked. According to the American Association of Clinical Endocrinologists, the most common cause of hypothyroidism is Hashimoto's thyroiditis. Despite the prevalence of Hashimoto's, thyroid antibodies are often not tested, so you may have Hashimoto's and not even know it. With Hashimoto's, your body attacks and destroys the thyroid gland piece by piece, eventually rendering your gland incapable of producing the hormones your body needs, eventually leaving you with full-blown hypothyroidism. You may not have symptoms of hypothyroidism, but the autoimmune process has begun. This process of destruction can take years. All the while you begin developing more and more hypothyroid symptoms. Yet your thyroid lab tests come back normal. Traditional mainstream MDs rely on a thyroid blood test called TSH, thyroid stimulating hormone, to diagnose and treat hypothyroidism. The problem with Hashimoto's is that your TSH can turn up normal while your body is quietly destroying your thyroid gland, and your doctor has no clue because the level of destruction hasn't yet triggered an abnormal TSH reading. The number one issue is that many traditional doctors do not test for thyroid antibodies. In mainstream medicine, TSH rules, leaving millions of Hashimoto's patients around the world undiagnosed and untreated. So, you must be an advocate for yourself and insist on the following two thyroid antibodies tests, which we do routinely on all of our thyroid patients. Those are TPO and TGB antibodies. So what are some of the causes of elevated thyroid antibodies and the Hashimoto's immune response? Some people inherit particular genes that predispose their immune system to misreact. During the course of a person's life, there are many possible triggers that can turn on those genes, like flipping a light switch. Now, once these genes are turned on, the body begins producing antibodies against their own body part, in this case against the thyroid. If the triggers are left untreated, the attack continues, so it is crucial to determine if one or more of these triggers are responsible for your condition. So what are these triggers? Well, food sensitivities, a leaky gut, adrenal dysfunction, stress, bad blood sugar, hormone imbalances, infections including viruses, parasites, bacteria, mold, even heavy metal toxicity. The biggest one is chronic inflammation in the body that's been going on for a period of time, and even vitamin deficiencies. So it's important to avoid and fix these triggers so you don't ramp up the immune system. Another major problem is that many traditional doctors refuse to treat patients who test positive for these thyroid antibodies, even when they suffer debilitating symptoms, all because their TSH level is normal. Unfortunately, TSH rules above all else in mainstream medicine when it comes to hypothyroidism. You may have Hashimoto's disease with elevated thyroid antibodies, yet all because the destruction of your gland has not yet destroyed enough of your gland to trigger an abnormal TSH reading, you are refused treatment and forced to cope with your symptoms. So what am I getting at? Well, it's TSH alone is not going to give you the full picture of thyroid health. The thyroid lab testing, at minimum, should include 10 tests described as follows: TSH, T4, T3, reverse T3, TBG, T3 uptake, and the 2 antibodies. There are 24 ways the thyroid can go bad. Leaving out any test will give you an inadequate picture of what's going on. So here's a problem. Well, what I mean by this is if you have one autoimmune disease, you are at high risk of developing other autoimmune diseases. When your immune system misreacts like this, your whole body is on the menu. If nothing is done to calm down that autoimmune attack on your thyroid gland, the risks are high that your immune system will then begin attacking other parts of your body. Dr. Mullen from Johns Hopkins says statistically somebody with an autoimmune disease is at risk of a total of 7 autoimmune diseases in their lifetime. So what needs to be done is to slow down the attack on the thyroid by reducing your triggers. This will minimize the destruction. If you need help with your thyroid issues, please call our office. We have a highly effective natural treatment solution for thyroid conditions. Also, if you have questions, you can email me at healthquest9443@gmail.com. I hope this video has helped you get more insight into how the thyroid works. And take care of yourself. Again, you may have Hashimoto's disease and you might not even know it.